All right, it's 3:01, so we have plenty of content for you. So we're going to go ahead and get going. Welcome everyone who has joined us today for our webinar, Reporting Out 5 Years of Early Care and Education, that's ECE, Systems Work in Illinois within the context of the COVID-19 public health emergency. I'm Sarah Flores, Senior Program Manager here at IPHI. And the Illinois Public Health Institute. I'll be moderating today's webinar. The Illinois Public Health Institute is a nonprofit that works through partnerships to improve public health systems to move toward equity and health equity for people and communities. A little bit of housekeeping at the top. Please go ahead. So participants are muted automatically throughout the webinar. So please type your chat questions in the chat box. You'll see that on your webinar menu. And also, please feel free to chat questions throughout the webinar because we will have an open Q&A section at the end. And so I'll start from those that came in as we were presenting. The webinar is being recorded, and I'm going to send the recording to all registrants. Closed captioning is available. Closed captioning is available. And go ahead and chat me, Sarah Flores, in the chat box if you experience any IT issues. We have three terrific presenters that we're excited about today. So Dr. Jamie Shrieky, who is a Senior Associate Dean and Professor of Health Policy and Administration in the School of Public Health at the University of Illinois at Chicago, UIC. She also directs health policy research for the Institute for Health Research and Policy at UIC, and she has over 33 years of experience conducting public health policy research, evaluation, and analysis. Also joining us is Julian Lader. He is a senior research specialist at the UIC Institute for Health Research and Policy. And then we have Beth Knight, who is the Senior Director of Learning and Development at the Illinois Network of Child Care Resource and Referral Agencies, INCRA. So today on our webinar, I'm going to be giving a brief overview of our ECE work connected to our SPAN grant. I'll be telling you more about that. Then we have Dr. Shrieky and Julian presenting on their evaluation findings from this ECE work. Beth Knight is then going to present on a number of system supports and trainings that we've been able to develop and launch through this grant program. Then I'm going to give us a quick tour of a state map we have on the Child and Adult Care Food Program, CACFP map. Then we'll have open Q&A time with our presenters, and we'll close. So briefly, this overview of our SPAN early care and education work. So backing out, SPAN is a 5-year program that is funded by the Centers for Disease Control and Prevention, and it's about implementing physical activity and nutrition interventions in Illinois. We work through 4 strategies, and early care and education is one of them. And the program is focused on reaching communities that are hardest hit by chronic diseases, such as communities of color, low-income populations, and rural populations. And it is led by my organization, IPHI, in collaboration with the Illinois Department of Public Health and multiple other partners. So as I mentioned, 4 strategies: food service guidelines, breastfeeding, physical activity in the built environment, and today's subject, early care and education, which has really been about implementing and integrating physical and activity and nutrition standards into our ECE systems. As we all know, ECE settings are an important place when it comes to children's health. So with chronic disease, nearly 2 in 5 U.S. children age 6 to 17 have a chronic health condition, and 60% of children in our state spend a significant amount of their time in childcare. And so childcare settings are an important setting where children can learn healthy habits and develop good health habits to help them grow up healthy and strong. Looking at some overall impact numbers, because we're now in year 5 of the SPAN program, so we're closing it out. And at a high level, the activities we're going to describe to you today have impacted at least 112,000 ECE providers. We've been able to enhance or develop new 12 systems, state-level system supports. We have 115 technical assistance providers throughout our state that are using what's called the Go Knapsack tool. It's an assessment and practice improvement tools for ECE providers. And we've been able to make that tool available for 5 years now in our state through SPAN. Over 75,000, almost 76,000 modules have been completed for trainings that have been updated or enhanced through SPAN. And we have over 10,000 programs, 10,694 ECE programs registered in this Go Knapsack tool system. So our work is guided by CDC's Spectrum of Opportunities for state-level obesity prevention efforts targeting the ECE setting. So really, this framework illustrates ways that states and communities can support ECE facilities in achieving best practices around childhood obesity prevention. And the spectrum areas we've worked in are TA assistance networks, pre-service and professional development. Beth Knight's going to be talking about that. QRIS, so the Quality Rating and Improvement System, and administrative regulations. And more recently, CACFP has been a focus. Just wanted to touch on two of the spectrum areas before we get into it with our presenters, and we'll naturally be touching on the others by our presenters. So when it comes to licensing and administrative regulations, so IPHI and our partners through a coalition that our organization convenes and administers called the Illinois Alliance to Promote Opportunities for Health, IAPO, formerly called the Illinois Alliance to Prevent Obesity. So IPHI and our partners through IAPO, which is a multi-sector policy and systems change coalition that's focused on chronic disease prevention. So, and this coalition has been working to advance the ISPAN work, the SPAN work. So our partners and us have been engaged in a years-long effort to realize physical activity and nutrition updates to childcare licensing rules 406 and 408. Those apply to family and group homes. Well, in 2014, a host of significant updates around physical activity, nutrition, and screen time were made to childcare licensing rules 407. That applies to daycare centers. And then there was a host of similar updates that were slated to be made to these standards for family and group homes, 406, 408. And we'd been advocating for these to happen. Well, they came out for public comment in the Illinois Register in 2021, and they have to go through a process to then be promulgated. Well, there's phases to that process, and the first one is a round of public comment. So the Department of Children and Family Services received over 350 comments in that first round in 2021, and those took time to process and integrate. And that slowed the entire process down, causing DCFS to miss a one-year deadline they have to actually adopt those updates. So the updates were then expected to be refiled in 2022 for another round of public comment, and then they would go through their process and hopefully be promulgated. But those have yet to appear. They have not come out yet. It was our intention to support the implementation of these important updates with SPAN resources, and we will continue to advocate to DCFS that those updates come out, be released for comment, and then be promulgated. So we're going to continue following it. One other thing I wanted to point out was when it comes to QRIS, which in Illinois is called Accelerate. These are program quality standards for childcare facilities, and they're in the process of being updated. And through SPAN, we've been working with the QRIS Policy Director and INCRA's Director of Professional Development to integrate nutrition and physical activity assessments and training into these updated quality standards. So a proposed update that's being considered would make the state's We Choose Health training, which was developed under a previous CDC cooperative agreement years ago, would be included as one of the training options to achieve silver level quality. And Go Knapsack would be the state-approved assessment as one of the few options for the gold level. So we'll keep you posted. These proposed updates are under consideration, and they're going through committee review process, but it's another exciting update that is in the works. So with that, I'm now going to turn it over to Dr. Shriki and her team to tell us about their evaluations findings. Jamie?
Thanks, Sarah. Can you see my screen okay? Okay, super. Thank you very much. And one thing I don't think Sarah mentioned is that we were honored to serve as the SPAN evaluators. And so this evaluation that we conducted was part of the SPAN evaluation. So joining me today is Julian Leiter, as Sarah mentioned, as well as our colleague Rebecca Schirmbach, who's also in the Institute for Health Research and Policy. And we had a doctoral candidate who actually just defended his dissertation, Jimmy Lin, who couldn't be here today. So we're going to briefly share with you the results of a study that we conducted between 2019 and 2022, looking at changes in early care and education providers' nutrition and physical activity practices across the state. So I'll tell you first about our key questions very briefly. I won't bore you with the details on the methods, but very briefly, because I'm an academic at heart, and then really focus on the key findings, both in the nutrition space as well as the PA space, and then implications for technical assistance training and advocacy. So we really had four very simple questions. The first one was, how did nutrition and physical activity practices change over time in Illinois from prior to the pandemic to, sort of quote unquote post-pandemic, or, latter part of the pandemic in 22. We then wanted to look at whether or not those practices varied by type of program, centers versus homes, whether nutrition practices specifically varied by CACFP or Head Start status or early Head Start, and then whether PA practices vary by Head Start status, because Head Start also has sedentary behavior standards in addition. So those were our four key questions that we looked at. As I mentioned, we conducted a statewide survey to capture providers' nutrition and PA practices and environments. We sent the initial survey out in December 2019 to INCRA's statewide list of ECE centers and homes. They were very gracious in sending out 6 follow-up emails and 2 Facebook posts between December 2019 and February 20. The survey was originally sent to over 7,300 recipients. We ended up with 942 valid responses, which, although it sounds low, it's still actually a fair amount of providers and it was representative from across the state. And then our follow-up survey was sent in October of 22. So if you remember, not that any of us could forget, but the pandemic really started in March of 20. And so we were really lucky. This was not by design. This was just luck, I think. We were really lucky that we were able to conduct the baseline survey before the pandemic started. And then we actually had decided to do a follow-up survey at the tail end in 22, after everybody sort of come back from sheltering in place and back with daycare programs operating more close to normal than they were in 21 and early 22. So for that follow-up survey, INCRA sent out a follow-up survey in October 22 to their list again, followed by 2 Facebook posts on their site, as well as sharing it via CCR in our sites and emails to them, and a final invitation by email from INCRA in November of 22. We had a much more complicated verification process because we got a lot of responses, as you'll see in a minute, from Facebook posts. And so we literally, poor Rebecca and our doctoral student, literally verified every single respondent to make sure they were legitimately ECE providers in the state of Illinois. And we ended up with over 1,200 responses to that second survey. Because of our recruitment process, and because the survey was completely anonymous, we do not have a longitudinal panel. So we're not looking at the same sites over time. We're looking at changes across the state in ECE practices over time, but not within specific providers. We looked at 14 different nutrition-related best practices and 9 physical activity-related best practices as identified by Go Knapsack, as Sarah mentioned. Other best practices identified by Caring for Our Children and the USDA CACFP program. We controlled for site-level characteristics that we compiled from the survey, as well as zip code level characteristics. And we did a bunch of statistical modeling to be able to look at changes over time, controlling for all those different characteristics. So what did we find? So first, I just wanted to share with you what our sample looked like at baseline and follow-up. On the left are the program level characteristics, and on the right are the zip code level characteristics. And as you can see, we did have differences over time, and it's really because of the differences in the percentage of respondents in the second survey that were responding from Facebook more than from just a survey. But the good news is we heard from homes and centers across the board in both time periods. We had a nice mix of providers in terms of the age groups they were serving. We had a mix of providers that offered free and or state subsidy only versus having tuition or fees or a combination thereof. In the follow-up survey in particular, we had a nice split of CACFP and Head Start participation. And as you can see in the follow-up survey, we had larger providers, so more centers. So that's why we, on average, they had more staff and a larger enrollment capacity. And then our zip code level characteristics varied, but they were fairly comparable from one time point to the other, and in terms of income and population size and rurality as well. The one thing I will note is that although we did see these differences from the baseline to the follow-up survey, as I mentioned earlier, we've adjusted for all these characteristics in our models. And so any differences we would have seen by these characteristics are accounted for in the regression models. So first, I'll look at the overall question of changes in meeting nutrition-related best practices from our baseline to our follow-up. In all of these slides, the green bars are for the baseline and the blue bars are for follow-up. And as you can see over on the left-hand panel with all these slides, anything with a star next to it means that there was a significant difference from pre to post. Across the board. And so it doesn't really matter for your purposes whether it's a single star, a double star, or a triple star. Basically, a star means that there was a significant difference over time. And as you can see, in many cases, the best practices declined over time, or meeting the best practices declined over time. I just want to clarify something because the best practices can be a little confusing the way they're listed here. These are basically meeting best practices for not offering or for only offering fried or pre-fried potatoes less than one time a week, or only offering fried or pre-fried meats less than one time a week. Like if they offer it never, that would be meeting the best practice. Or making drinking water always available, or never offering sugary drinks to 1 to 5-year-olds. So you can see for a number of these characteristics or best practices, the fried foods, the sugary drinks, as well as for sugary cereals in particular, and not using food to calm or encourage children, we saw significant declines from pre to post in those practices. And this will be important to note when I get to implications of all this. We then wanted to look at differences between centers and homes, and pretty much across the board, the place where we saw changes were in the centers more so than in the homes. For the ones that we saw have triangles next to here, that's where we saw a significant difference for centers versus homes over time. So if you just look in the left-hand panel, you can see that for very similar best practices, we saw a significant reduction over time within centers of meeting the best practices for fried foods, for meeting the best practices for sugary drinks, sugary cereals, authoritative feeding styles, and using food to calm or encourage. We also saw for a number of these characteristics a significant difference between centers and homes over time. Again, typically with homes, more likely to either have maintained where they were from prior to the pandemic or slightly improving. And it was really centers that saw the drop off over time, which is really notable given the 407 standards have been in place for a while. CACFP standards have been in place for a while, but you'll see in a second here that we saw similar patterns with CACFP versus non-CACFP programs. So here we found that CACFP programs experience more changes and were less likely to meet nutrition-related best practices over time than were non-CACFP programs. And as you might recall, during the pandemic, all the federal child nutrition programs, including CACFP, they were allowed to, states opted into the waivers, which basically allowed providers to forego meeting the meal pattern requirements. And so one of the biggest concerns that happened at that time was, although that was good because it allowed for providers to readily make foods available for children and their families, the concern was what would be the impact on the nutritional quality of the foods that children were obtaining, whether it was at the site or through a provider distributing it off-site. And as you can see here, because the CACFP programs were subject to those waivers, we actually did see a decline in what CACFP providers were reporting in terms of the extent to which they were meeting best practices, again, in terms of the fried foods, in terms of the sugary drinks, in terms of sugary cereals, and in terms of using food to calm or encourage children. Again, the ones with triangles, we also saw significant differences between being a CACFP program and not a CACFP program over time. Head Start programs also saw significant changes, and because we had a lot of centers in the study, it's not surprising that Head Start programs in particular saw significant declines over time, because a lot of Head Start programs were closed during the sheltering in place requirements, right? And so, they really had quite a bit of drop off in a lot of these same best practices, and even more so than what we saw with CACFP or in the state overall. And again, in most of these cases, we saw significant differences over time between Head Start and non-Head Start programs, again, with the non-Head Start programs really not falling off by much at all. When we turn our attention to physical activity, the story is a little bit different. So overall, across the board, the only best practice that we saw a significant decline across all providers with regards to PA related to the best practice of allowing toddlers to be seated for less than 15 minutes at one time. That's the only one that we saw a significant change over time, and it was a reduction from baseline to follow-up. However, once we look at it again for centers versus homes, again, it's the centers that we really saw changes. And so this prior slide, we didn't see much of a change overall, regardless of program type. But when we break it down by program type, you can see that in many cases, the centers again had some fall off as compared to what we saw with homes. Homes were either increasing their compliance with the best practice or maintaining where they were. In contrast, the centers, we tended to see reductions in meeting screen time best practices, in meeting the toddler seating requirement, in meeting children seating requirement, in meeting screen time requirements, and in meeting playtime, outdoor playtime requirements. So regardless of whether you're talking about nutrition or physical activity, it's really centers where we're seeing a lot of the drop off as compared to homes. And so it's really interesting, given this whole dynamic with the 406, 407, 408 standards. It doesn't matter that we have 407 in place. This is like our new normal, right? This is our new baseline, and we're really going to have to do some work across the state to get centers back to even where they were before the pandemic started. We saw similar patterns to what we saw with nutrition in terms of Head Start. Again, Head Start programs, we saw a drop off in meeting best practices for physical activity as compared to non-Head Start programs. So I've shared with you a lot of implications as I've gone through the presentation, but just really quickly, we in general, we saw declines over time, particularly pronounced for center, CACFP, and Head Start. As I just mentioned, this is our new baseline. And while the proposed regs, and we've been waiting all, 5 years that we've been on ISPAN, or, several years, 4 years, I guess, right? At this point, Sarah, 3 years that we've been on ISPAN for these proposed changes to 406 and 408. We need to get back and focus on the centers in the meantime, because they've got a lot of ground to make up from where they were prior to the pandemic. So with that, I'm going to stop and turn it back over to Sarah. I forget if we're taking questions right now or if just at the end. So thanks, Sarah.
Yep, we'll take them at the end of the presentation. So thank you. But feel free, if questions come up for you, go ahead and chat them, and then we will circle back. Thank you, Jamie. All right. Bear with me. Let me just share my screen again. Okay, now I'll turn it over to Beth Knight.
All right, thank you, Sarah. I'm pleased to join everyone today, and wanted to share a little bit. We have been in partnership with IPHI for several years and have been delighted to partner on the SPAN work. As we get started, I will do a quick shout out to Lynette Woodard, who is the Instructional Development Manager at INCRA and leads a lot of this grant and project work. So I wanted to say thank you to her for that. So I am happy to be here to share highlights from our partnership efforts with IPHI and others involved in the State Physical Activity and Nutrition, or SPAN grant. Our work with IPHI began in 2018 when INCRA recruited 3 child care resource and referral agencies, or CCR&Rs, to host learning collaboratives. The learning collaboratives consisted of each participating CCR&R recruiting 5 to 6 child care programs to complete a series of trainings aimed at improving nutrition and physical activity practices through the use of the Go Knapsack online tool. And Sarah referenced that earlier. It's the online assessment tool. And I'll talk more about how we've built a liaison network around that moving forward. Along with the 3 learning collaborative regions, all of the CCR&R statewide were invited to participate in the training of trainers presented by Nemours Children's Health. For those who may not be familiar, we've got 16 child care resource and referral agencies in the state. And then you can see in year 2 in FY20, we added 2 additional CCR&Rs hosting learning collaboratives as well. As I mentioned, the Nemours Healthy Kids, Healthy Futures was what we used in the design of the Learning Collaborative project, and it was the 5 learning sessions, and those were designed for technical assistance support from the local R&R staff. They were offering that between each of those training sessions, so they were coaching programs through the process of completing the Go Knapsack, self-assessments, and setting goals for program improvement. The 5 topics included taking steps to healthy success, nurturing healthy eaters, family style dining and supporting breastfeeding, getting kids moving, and reducing screen time. And through the course of this, then the numbers of and successes that were recorded in Go Knapsack, we reported those regularly to IPHI and to others who were analyzing the data. As I mentioned earlier, the Go Knapsack Technical Assistance Network, in year 3 of the grant, we worked with each of our 16 local child care resource and referral agencies to identify a point person to serve in that liaison role. We established a timeline with checkpoints, so that would help with program recruitment and regularly scheduled Go Knapsack participation. We were fortunate through the grant efforts to be able to provide some marketing materials for each of the local child care resource and referrals. So they're able to distribute those to participating programs. And then we stayed in regular communication with folks and set quarterly calls with all of our Go Knapsack liaisons. We would collaborate over recruitment strategies. We would discuss some of the Go Knapsack website features and then some of the supports provided by the University of North Carolina. Through the course of the SPAN grant, there's been a lot of emphasis on and support for the development of new trainings. We're pleased to bring those forward. The PALS learning sessions, the physical activity learning sessions, which were the basis of the Learning Collaborative project, those are available to be trained face-to-face in any of the local child care resource and referral agencies who has a trainer that participated in the TOT with Nemours. And then the other trainings that we have developed as part of the SPAN grant include, you see the list there, the Breastfeeding University for childcare providers, supporting breastfeeding friendly environments, introduction to child and adult care food program, and then revisions to We Choose Health. So specifically, the Breastfeeding University for Childcare Providers was designed or developed by the Carolina Global Breastfeeding Institute of UNC to support breastfeeding families. So we were able to work in partnership to bring that training and host that training for providers in Illinois. The Supporting Breastfeeding Friendly Environments we developed with IPHI and support from CDC, really designed to help childcare providers understand how to create breastfeeding friendly policies and environments. It covers state and federal laws and specifically aligned to Illinois licensing standards. The Introduction to Child and Adult Care Food Program, our newest trainings, one of our newest trainings, it's designed to educate family and group daycare providers on the ins and outs of the USDA funded program that reimburses the cost of eligible meals and snacks directly to the provider. And then revisions to We Choose Health. It's a training series that was developed several years ago. Sarah mentioned that earlier, through a previous grant aimed at improving public health and specifically curbing the rise in childhood obesity. This year, we've worked with IPHI to revise We Choose Health to include more current language in the childhood obesity module, reframing the issue to focus on chronic illness and how following best practice in childcare settings can influence children's health for a lifetime. And then finally, we've, as I said, in addition to the new trainings, we've done some enhancements and redesign on existing training content. So we've done that to several of our gateways trainings, gateways to opportunity, and our online e-learning system. So we made those edits to trainings based on the anticipation of the 406 and 408 updates into rule. Both several people have mentioned those previously today. It includes the latest research and the best practice information for topics such as the breastfeeding and infant feeding, nutrition. You know, some of these were mentioned earlier, screen time, and then tummy time for infants and outdoor and active play recommendations. So we also made these changes to trainings in our Gateways ECE Level 1 credential modules, and then the child development, health, and safety basics. I think that's what I had, so.
Thank you. And it was exciting to see all those different trainings and collaborative opportunities launched, get carried out. Okay, so now I'm going to give a little overview of our state CACFP map, Child and Adult Care Food Program. So let me go ahead and share the map. Oh, bear with me one moment. Okay, you should be seeing that now. So you're looking at the homepage for the map, and I'll chat this momentarily. But through the courses span, we were periodically offered opportunities through what's called Springboard for Health. And that is, hold on, let me just, okay. Time-limited opportunities that are offered by Nemours Children's Health and what's called the Healthy Kids, Healthy Future Technical Assistance Program. So a series of one-time opportunities that would provide capacity building, technical assistance, resources to help advance SPAN state action plans around healthy eating and physical activity in ECE settings. So one of these that came to us in year 4 was to create a GIS map around CACFP in our state to support outreach and promotion activities. And we worked with Child Care Aware of America, and they developed the map in partnership with, we also work with the Illinois State Board of Education and INCRA. And we also had a local advisory committee of local stakeholders and partners who could help guide and the development of the map and to talk about usage. So I'm going to take us, and just to reiterate, CACFP is a federal nutrition program that eligible care program serving
Sarah, I'm not sure if it's just me, but we can't hear you.
Oh, can you hear me now?
Yes.
Okay. And when did you stop hearing me? Just now?
About here when you're
Okay, good.
when you're about to explain the map.
Perfect. Okay, good. Then that was the exact right place. Okay. Hold on a moment for this to just load. Okay. So first things first, we were able to populate this map with some information on what is the state of CACFP participation. So we uploaded the total list of licensed and license exempt providers in our state, and we mapped that against the list of family and group homes that participate in CACFP. And that's what you see before you in the map in the center of the screen. So of the 11,097 programs total that we have in our state, 5,413, that is 49%, participate in the CACFP program in 2022. This is a snapshot in time, so it's just for 2022, what we had at that time. And you can see that graph on the bottom of the left-hand side of the screen showing the 49%. So of those, 62% were family childcare, 25% were centers, and 10% family and group homes. I'll also point out that there are 32 counties, 31% of our state, where fewer than half of childcare programs participate in the CACFP. So on our map, it gives you these layers that I'm clicking on now that give you a number of ways to manipulate this information. So right now it's on cluster view where it shows big pockets of participation, and blue is participate, red is does not. But I'm going to go ahead and put it on. Oh, hold on. Individual data points. So this allows you to get quite granular in, which programs are participating in counties across our state. Very helpful in outreach efforts. So I want to point out a couple of other major data sets that inform what we're seeing. Number one is food deserts. So food apartheid is becoming a more common way to describe that, but a food desert or apartheid, I will use desert going forward, but just be aware that there's two terms for it. That is where there's low access to healthy and nutrition food within 1 mile for urban areas and 10 miles for rural area by census tract. So there are 994 census tracts that are designated as food deserts in our state, and those are brown. So if I take and I add the mapping for childcare programs, there are 3,528 programs in our state that are operating in food deserts, and 1,900 of them, about 54%, do not participate in CACFP. So if I zoom in, and here we have our county outline, you can see an example of in a food desert area, 2 that are not participating and 1 that is. I also want to point out poverty levels. So another data set that we were able to show here, and I'm just going to remove the childcare site so you can see, is concentrations of families with children under 5 that are at the 185% federal poverty level. So this map shows if it is purple, that means there are high concentrations, so about an average of 23 families per census tract, I believe, and darker purple means even higher concentrations. So there are 7,635 programs that are operating in these higher poverty areas, and you can see that here. So the third thing I want to show is when we have both. So I'm going to hide that and enable this other layer. So Child Care Aware of America was also able to show us the overlap. So when you see these areas in yellow, they are both a food desert and an area with high concentrations of families meeting that poverty level we talked about earlier. So if I go ahead and enable our map and I zoom in, so there are 2,215 programs not in CACFP that are operating in areas that would be defined as a food desert and have those high poverty rates. So I want to just quickly show you, and on the right-hand side, you can see you can pick out individual counties. So if I pick McLean County, which has the city of Bloomington, there are 36 programs that are operating in this highlighted area and 61 that are within a 2-mile radius. So again, if we're just looking at where to target, if it's low-income areas are going to be areas of potential greater need because not having access to food or healthy food, nutritious food. All right, and one other set I want to show you is the Child Opportunity Index. So if I zoom back out and I take it off McLean, okay. Okay, now it's coming. Forgive the lag. Okay, so the Child Opportunity Index is a rigorous data set that is maintained by Diversity Data Kids. So it looks at 20 different factors that really tell a story about the quality of resources and conditions in neighborhoods across our state and like wider than our state, but we're concerned with our state. And they tell a story about these neighborhoods and their existing embedded inequities and the impacts on the children who live there. And so this index, the Child Opportunity Index, is statistically significant predictor of childhood outcomes in adulthood. So it provides us important context of what's going on in our state when we talk about CACFP expansion. So if I just go ahead and add, so the darker green areas are areas of greater opportunity. The lighter green you get is less opportunity. So I'll just show you quickly Kankakee County. And in Kankakee, there are 22 non-participating programs that are operating in lower opportunity areas. So I'll chat the link to this map, but we are going to use this to guide our work as we continue to discuss how to utilize it to promote uptake and retention and awareness of this important program. All right, with that, we're now at the Q&A part. So I see some questions come in. I invite you to write in the chat questions you have for our presenters, myself, anyone who's spoken today, and we'll go ahead. So question coming in, and I'll read them out because you're muted. So is this a report? Is this just a report for 2022 or it is an annual report? It is just a snapshot in time for 2022. We did explore whether there were opportunities to update it, but there are not at this time. Do we have other questions for our presenters? Oops. I was wondering, Jamie, I don't know if you'll be able to answer this because you look at the data, but with this drop off with centers, like we can kind of extrapolate reasons why this happened, but I just wondered if you had any impressions on like why we saw the drop off in centers most of all.
A couple of reasons. One, the centers were more likely to be closed during the pandemic, at the heart of the pandemic. Two, the nationwide waiver, as we discussed, or as I mentioned, the waivers were great because they made it a lot easier for ECE providers to make food available and not meet the meal pattern standards. So it gave them a lot more flexibility with when and how they provided food and what they provided. But the big concern, and so it was great from a food insecurity standpoint, right? It was great in terms of making sure that children were fed. So that's fantastic. But in terms of the quality of the foods and beverages that were being, that are, centers are reporting, that was the concern in the nutrition field about what the implications of the waivers would be on the quality of foods that were being offered in providers in CACFP in particular. So I think for CACFP in particular, and Head Start programs tend to follow CACFP. That was really sort of driving a lot of the decline in what we saw with CACFP and Head Start programs. And then you combine that with the fact that a lot of the centers were shut down for longer periods of time. And when they did kick back in, it's at limited staff capacity, limited supply chain issues, all sorts of things that home-based providers don't typically encounter. Because home-based providers typically, go to the local grocery store, and Becca and I did a paper on procurement and purchasing by CACFP providers a number of years ago, and we looked at differences by different types of providers. And smaller home-based providers tend to sort of clip coupons and go to wherever they can get the best deals on the foods that they're providing. And if they do participate in CACFP, then they'll be complying with state standards. They'll be more likely to do so, but centers are a whole different ballgame. So, I really think that the waivers more than anything and the closures were probably what was behind it. I can't say it's causal because we didn't have any mechanism for looking at causal impacts, but that's my hypothesis.
Thank you. That's interesting perspective. Beth, I'm just wondering to open the floor if you had any reaction to Jamie's findings. And of course, you've been developing all these trainings and this is your wheelhouse, but I don't want to put you on the spot, but feel free to share if you did.
Well, I think the impact of the pandemic, all that's been said plays into that. I think from our perspective, particularly around the training delivery, the availability of trainings on iLearning, the partnership with the 16 R&Rs that cover all 102 counties, I think we continue to look ahead to the opportunities, particularly the connectors to the Child Care Assistance Program. So providers who are part of that state-funded program have a requirement to have baseline trainings and orientation to be approved for that, but then they have a renewal effort around health and safety. And, we just continue to explore options to create training opportunities, to share resources, to use to maximize the relationships in the communities across the state to help inform providers to make connectors through social media, through website postings, all of those things, in addition to the online training. So I think we continue to keep an eye on things, figure out ways that we can maximize our system efforts to offer supports and help to improve those practices.
Thank you. Just interested in your thoughts. I just chatted the map to our state, or the link to our state CACFP map for those that are interested. And question coming in, would you be willing to share this presentation with Head Start, early health and nutrition managers? So the recording will be available on IPHI's YouTube, and I'll send that around. And I think we're just checking on a couple things as far as sharing out the slides. We'll certainly have the link available. Okay, any other questions for our presenters? I'm going to give it a couple seconds so you have time to think if there's any further. Okay, let's see. We got one. Do you have any feedback from providers about outdoor and active play experiences?
I don't know, Beth, if you have any. Our survey just asked, about, what, whether they were allowing for outdoor play time and sort of meeting active play best practices, but we didn't do any qualitative work to sort of, or open-ended questions to ask them about what they were doing. And that's actually something that we've identified as an area for follow-up. All of us on this call have spent a lot of time in the nutrition space, and quite frankly, putting my other hat on, which IPHI has too, of the built environment and physical activity. I'm really passionate about physical activity amongst young children and opportunities for physical activity. And I think this is an area that really needs some more research, because we've done very little in the state on physical activity and sedentary time in ECE programs statewide, as compared to all the efforts that have gone towards nutrition and feeding.
Thank you. And I just posted a link in the chat box of a focus group report we did earlier on in SPAN, I think 2021, yes. And it is a joint project with IPHI and the Family Resiliency Center at the University of Illinois at Illinois Urbana-Champaign. So we did a set of focus groups to better understand needs, implementation practices, and barriers being experienced by ECE providers around the state. So we did some in Peoria, one in Peoria, Cook County, West Chicago, Lake County, Champaign. And we really made efforts to recruit providers from low-income, rural communities, communities of color, to explore some of that. So I think these report findings definitely touch on the outdoor physical activity and a number of other things that could be illuminating. So I chatted that link for you.
And I will note that Becca and I, along with our colleague Yuka Asada, have a paper coming out in a special issue of the American Journal of Public Health Association on barriers and facilitators to nutrition-related practices amongst CCFP providers in particular. And that'll be open access in the state of Illinois. And that was entirely a qualitative study as well. So when that becomes available, Sarah will share that with you to send out to the group. And in terms of Lori's question, at least on our part of the presentation, we'd be more than happy, Lori, to do our data or evaluation presentation for Head Start, if that would be helpful.
Great, thank you. All right, I'm going to go pull up my slides back up, and I'll keep an eye out if other questions come in. Okay. She said, thank you. One more. Is it easier to gather data on nutrition than physical activity?
It depends what type of data. So if it's provider data, it doesn't really matter. In some ways, it's actually easier for providers to answer questions about the physical activity environment and physical activity practices, because it's pretty straightforward. Do you allow, do you minimize sedentary behavior to less than 15 minutes or whatever, versus nutrition? It's very specific nutrition standards, right? And so some of them are cut and dry, like no sugary cereals, no sugary beverages, but others are a little bit more, you need to think about it a little bit more. And so if you're asking providers these questions, in general, they're not really hard questions. We've done a lot of nationwide work in this space, and we've always had a fairly reliable and robust response to our surveys in this area. If you're talking about data collection of individual children, behaviors and practices, then it would be easier to capture, the physical activity time and sedentary time more than it would be to capture actual intake of various nutrients and foods and beverages, but it can be done, and there are ways to do it. It's just a little more challenging in the ECE space than it is like in schools or outdoor settings, or recreational settings, I should say, excuse me.
Great. And Teresa, I see you have a hand raised. If you had any additional follow-up question, please feel free to chat it in the chat box.